Everyone, welcome to Metaverse Atlas, and today we are going to discuss an interesting topic which is medically very much clinical oriented, that is shock. Okay, so this is an important topic in terms of medicine and surgery, also, it is very much important. Okay, so without any delay, let us know what is shock. So, what is shock basically? So, it is defined as it is a syndrome. That means there are many clinical features we get to see in the shock. So, it is a syndrome in which there is inadequate tissue perfusion associated with absolute decrease in cardiac output. So, what do you mean by tissue perfusion? Inadequate tissue perfusion, that means there is very low blood supply to the tissues. Okay, decreased blood supply to the tissues as well as low cardiac output. So, because there is low cardiac output, there is decreased tissue perfusion. Okay, that is what we call it as shock. That condition is what we call it as shock. So syndrome means there are many clinical features, there are many disease, like many features that we get to see in this shock. So it is together we call it as syndrome. Okay, so what are the types of shock? So basically there are four types of shock. What are those? The first one is hypovolumic shock, distributive shock, cardiogenic shock, and obstructive shock. Okay, so let us discuss each type of shock in detail. Out of all the four shocks, the most important type of shock is the hypovolumic shock, and this is very asked as a clinical case. Okay, in your university exams, it can be asked as a clinical case. Okay, so this is an important type of shock. So, what is hypovolumic shock? So hypovolumic, in the name itself, it suggests that there is decreased body volume. It is there is decreased body fluids. There is decreased blood volume. Okay, in the body. That is what we call it as hypovolumic shock. So it occurs due to decreased volume of fluid in the vascular system, as I've already said. Okay, that is what we call it. That leads to shock. That is what we call it as hypovolumic shock. Okay, so what are the causes of hypovolemic shock? Probable causes. So it may be caused due to acute hemorrhage, that is acute blood loss due to external or internal factors. Okay, injury, like in the road accidents there are injuries, so there is blood loss. Okay, that will lead to hypovolemic shock. Or it can also be due to surgical shock, like while any kind of medical surgeries, also there can be a rupture of blood vessels which can lead to blood loss. Okay, that can lead to hypovolemic shock. Burns, okay, whenever the person is burnt in an accident, okay, in a hazard, then that can also lead to hypovolemic shock. And diarrhea and vomiting, these are the most common causes of hypovolemic, like it can lead to hypovolemic shock in severe cases. Okay, so but the main cause of the hypovolemic shock is acute hemorrhage more than 15 ml per kg body weight results in shock. So the acute hemorrhage means the blood loss. If the blood loss is more than 15 ml per kg body weight, this is the number you need to remember. If the blood loss exceeds more than this, then that will lead to hypovolemic shock. That is shock that occurs because of blood loss from the body. Okay, this is the main cause of hypovolemic shock. Okay, so these are the probable causes. In the clinical case, they might give you these clinical features and they'll ask you what is the type of shock, identify, explain the clinical features. So in the exam, because now we are having the competency based exam curriculum, they'll be asking you a clinical case and they'll be asking the probable diagnosis by means of this clinical features. Okay, you are supposed to identify the type of shock, and after the second question will be what are the causes of the clinical features. Okay, so we have to know the clinical features and we have to know what is the reason behind that clinical feature. Okay, and at the last they'll ask you the treatment. What is the treatment of this probable diagnosis? So basically you need to know everything about shock. Okay, everything about any clinical any topic. Okay, so what is the pathophysiology? So what are the clinical features in shock? That is what we need to remember. The most common and the most important clinical feature in the shock is hypotension, that is low BP. Okay, low BP is the most uh, like the most evident feature in the shock is low BP. So what is the cause of the low BP? They'll ask you in the exam, explain the causes of the clinical features. So low BP, why does low BP occur? Okay, due to low blood in the body because of blood loss. So there is increased blood loss that will lead to low blood venous return. Okay, so the venous return, if there is low blood, then the venous return, the blood returning to the heart also will be less. Okay, that will lead to low stroke volume. Okay, whatever the blood is coming to the heart through venous return, that will stroke volume will also be less. Okay, because of low stroke volume there will be low cardiac output. Okay, because of low cardiac output ultimately there will be low BP. Okay, this is the cause of low BP, and this low BP will lead to hypovolumic shock. Okay, like this is the clinical feature that we get to see in the hypovolumic shock. Okay, so the first clinical feature is hypotension. We have discussed what is the cause of hypotension and how hypotension is developing. Okay, the second clinical feature that we get to see in the shock is tachycardia. What is tachycardia? That means increased heart rate. Okay, this increased heart rate is what we call it as tachycardia. Now, what is the reason behind increased heart rate or tachycardia in the hypovolumic shock? Why does this occur? So, this tachycardia is basically a compensatory mechanism that comes into action because of low BP. So, in order to understand shock, we all need to know blood pressure in detail, okay, and the compensatory mechanisms in detail. So, if anyone has not watched that, then the link is in the description. Please do watch the blood pressure before coming to shock. So because of low blood pressure, there will be a baroreceptor reflex that gets activated in response to low blood pressure. Okay, that is a compensatory mechanism that gets activated that will increase the heart rate, and thereby it will normalize the BP. It will regulate the BP. Okay, it will get the BP back to the normal. So so this is a regulatory mechanism. There is a compensatory mechanism that comes into action. That is the reason for increased heart rate or tachycardia. So what is the reason for tachycardia? Is because of the low BP, the regulatory mechanism, the compensatory mechanism comes into action, and that is the reason why there is increased heart rate. Okay. Now, what is the reason for rapid and thready pulse? So the third clinical feature that we get to see, third and the other most important clinical feature is rapid and thready pulse. Now, what is the reason behind the rapid and thready pulse? Okay, so the pulse increases, the heart rate increases, but it is rapid. Why it is rapid? Because of baroreceptor mechanism. Okay, but what is the reason behind thready pulse? Thready means weak pulse. Like when you palpate the person who is suffering from hypovolumic shock, the pulse is very much weak. What is the reason behind it? Because of low blood pressure, and because of low blood pressure, that means there is low blood volume. Okay, if the blood volume is low, then the blood pressure will be low. If there is very lesser amount of the blood in the person, then the pulse cannot be palpated in a proper position, in a normal position. Okay, that is the reason behind rapid and thready pulse. Now, another most important clinical feature is cold and clammy skin. Okay, what is the reason behind cold and clammy skin in hypovolumic shock? So, in hypovolumic shock, as I've already said, there is low blood pressure that will lead to blood flow to the vital organs decreases. Okay, the blood flow to the vital organ decreases. Now, what will happen if the blood flow to the vital organ decreases? This is compensated. This is very much dangerous. Okay, vital organs should always be perfused properly. Okay, in a adequate blood. So once this blood flow to the vital organ decreases, at that time the compensatory mechanism gets activated that causes vasoconstriction, because blood flow should be continuous to the vital organs like heart, like liver, kidney, all these vital organs. Okay, so for such organs the blood has to be maximized. That is the reason vasoconstriction comes into action. This vasoconstriction, what is causes, it diverts the blood flow from the skin to the vital organs. So whatever the blood that is present in the superficial layers of the skin, that blood is diverted from the skin to the vital organs by means of vasoconstriction. Okay, this is the role of vasoconstriction, which is a compensatory mechanism that gets activated due to low BP. Now what is the reason? Like we are discussing the reason for cold and clammy skin. Okay, so once the blood is diverted from the skin to the vital organs, the skin becomes cold. okay, and clammy. That is the reason why the person appearance is the skin of the person becomes cold. Okay, that is the reason behind this. I hope this is clear. Now, in the exam, in the clinical case, they'll ask you the treatment also for the diagnosis. Okay, so you can simply write the treatment for the causes of the blood loss. If the blood loss is due to hemorrhagic, if the blood loss is due to accidents, then the treatment will be different, right? So first they have to apply pressure to the site of the site of bleeding. Okay, this is the treatment. So treatment varies depending upon the cause of the blood loss. Okay, and saline infusion is the most common treatment that is given in the hypovolumic shock. So this is about hypovolumic shock. The second type of shock is distributive shock. Okay, what is distributive shock? In this type of shock, the blood volume is normal. Okay, unlike the hypovolumic shock that is caused because of decrease in blood volume, unlike that, it is not like that. In this type of shock, the blood volume is normal, but there is decrease in BP. Okay, decrease in BP is common in both the things, but here the cause of low BP is sudden increase in vasodilatation. So vasodilatation means dilatation of blood vessels. So whenever there is increase in the vasodilatation in the body, that will lead to low BP. We all know why vasodilatation causes low BP, right? So because of vasodilatation, there is this type of shock. Okay, that is distributive shock. But one thing we need to remember, that there is blood volume is normal. Okay, in the question they may mention you that the blood volume is normal, but what is the cause of the person suffering from, what is the type of shock the person is suffering from, and what are the causes, they can ask you in this way. So in this type of shock, the blood volume is normal, but there is a low BP because of vasodilatation. Okay, now what are the causes of vasodilatation? Neurogenic shock, anaphylactic shock, and septic shock. These are the three probable causes you need to remember as it is. Okay, that can lead to distributive shock. Okay, so this is about the second type of shock, that is distributive shock. So whenever there is low BP, then we all know that that can lead to shock, that is decreased blood perfusion, tissue perfusion to the tissues, right? Decreased perfusion to the tissues. Okay, the third type of shock is the cardiogenic shock. Okay, what is cardiogenic shock? In the name itself, it is suggesting that there is defect in the heart. What is the defect? There is decreased pumping ability of the heart. Now, what will happen if the heart is not pumping the blood in an adequate quantity? If there is decreased pumping ability of the heart, then will lead to decreased cardiac output. If the cardiac output is more, then it is said to be shock. In the definition itself, we have discussed that shock is nothing but the first thing is low cardiac output. Now, what is the reason for the low cardiac output? That is because of low pumping ability of the heart. That's why it is named as cardiogenic shock. Okay. So, what are the causes of cardiogenic shock? So, myocardial infarction. Okay, myocardial infarction, heart failure, and cardiac arrhythmias. So, these three are the most common causes for the cardiogenic shock. Okay, all these three causes are related to the problems in the heart. Okay, that's why it is very simple to remember that these three are the causes for the cardiogenic shock. And the fourth type of shock is obstructive shock. Now this also, the name itself, it suggests that obstruction, there is obstruction to the blood flow. Okay, so what is obstruction? So whenever the blood is ejected from the heart, okay, from the ventricle of the heart, there is obstruction in between, in the flow of the blood. Okay, in the ejection of the blood there is obstruction. So this type of obstruction will not cause the cardiac output, will not lead to cardiac output. So if there is any obstruction in the flowing of the blood, which is preventing the cardiac output, ultimately there is shock. Okay, so because of the obstruction, if the cardiac output is decreasing, then that is why we name it as obstructive shock. It can be any type of obstruction. What are the types of obstruction? Like cardiac tamponade, cardiac tumor, like tumor in the heart, carditis, okay, tension, pneumothorax, and constructive pericarditis. All these are the probable causes for the obstructive shock. Okay, so these are all the types of shock. Now, the second most important subheading in this topic is compensatory mechanism. So what is compensatory mechanism? Okay, what is the compensatory mechanism means how our body reacts to the shock, how our body responses to the shock, how our body regulates the shock. That is what we call it as compensatory mechanism. So in the compensatory mechanisms also there are stages. Okay, what are the stages? The first stage is compensatory stage, where if the blood loss is less than 10% of the total blood in the body, then it can be compensated, it can be controlled. Okay, that is what we call it as compensatory stage. So if the blood loss in the body is less than 10%, it can be managed. It can be managed or compensated by the body. That is the stage that we call it as compensatory stage. Okay. Now what is second stage? That is progressive stage. What is progressive stage? If the blood loss is more than 10%, that is what we call it as progressive stage. Okay. And if the blood loss is more than 15%, that is what we call it as irreversible stage. That means the body cannot control or balance the change. Okay, it cannot manage the shock. That is what we call it as irreversible stage. Okay, let us discuss the compensatory stage first. So what happens in the compensatory stage? Acute loss of less than 10% of the blood, right? That is what we call it as compensatory stage. So what happens in the compensatory stage? Because of blood loss, there is decreased venous return, that is very much evident. That will lead to low stroke volume, low cardiac output, and ultimately low BP. This is already we have discussed. Like this is what occurs in the shock. Now how this is compensated, that we need to know, right? So how this is compensated is by this low BP. Whenever there is low BP, we know in the BP video we have already discussed, whenever there is low BP, the baroreceptor mechanism gets activated, the renal mechanism gets activated, and the ADH mechanism also gets activated. So this baroreceptor mechanism is a short-term type of regulation that will lead to vasoconstriction, that will increase the heart rate, that is called as tachycardia, that will ultimately lead to cardiac output, increase in cardiac output, that will ultimately cause increase in BP. Now renal mechanism, the renin secretion, that will lead to aldosterone release, that will lead to increased BP, okay, by causing water and electrolyte retention, whereas the ADH mechanism, this is also a long-term type of mechanism that will cause water and electrolyte retention directly, and in the kidney that will lead to increased ECF volume, and ultimately it will lead to increased BP. Okay, this is the this compensatory stage. Okay, the second one is the progressive stage. Okay, the second one is progressive stage. Now what happens in the progressive stage? There is blood loss more than 10% of the body blood. Okay, entire body, if the blood loss is more than 10% of the total blood, then what happens? There is severe reduction in the venous return, cardiac output, and blood pressure. Now what happens if there is severe reduction? It will lead to severe myocardial ischemia as well as suppression of vasoconstriction center. So what is myocardial ischemia? There is release of toxins from the cardiac tissue. So myocardial ischemia means there is decreased blood supply to the heart. Okay, there is decreased venous return to the heart. So what will happen if the heart does not get enough blood? It will release toxins from the tissues, cardiac tissue. Okay, that will lead to deterioration of the cardiac function. That means the heart does not function properly, effectively. Now, what happens when there is suppression of the vasoconstriction center? It will lead to severe vasodilatation. Okay, vasoconstriction center. What is the role of vasoconstriction? In the name itself, it is suggesting that it causes vasoconstriction. So, whenever there is suppression, it will lead to vasodilatation, severe vasodilatation, and further it will lead to decrease in BP. Okay, it will further lead to decrease in BP. Okay, vasodilatation means there is decrease in BP, we know that very well. So that will also lead to deterioration of other tissues function. If the blood pressure is low, then the blood flow to the other organs will be low, so the other organs function also will deteriorate. Okay, this is about the progressive stage. This is what happens in the progressive stage. Now the last stage of the shock is irreversible stage. Now in this stage, nothing can be compensated. Okay, because the blood loss is more than 15%, so this is very much severe. Okay, so this cannot be compensated. This is called as irreversible stage. Okay, what happens in the irreversible state? Why it cannot be compensated is because There is decreased coronary blood flow. Like the coronary arteries in the blood, in the heart, they are not getting enough blood, okay, enough venous return. That is why there is myocardial ischemia. Okay, because of decreased coronary blood flow, there is myocardial ischemia. It will ultimately lead to cardiac failure. So cardiac, whenever there is cardiac failure, the person will ultimately, uh, it can cause death of the person. Okay. And another reason for that is decreased cerebral blood flow. Like there is decreased blood supply to the brain. What will happen if there is decreased blood supply? That is what we call it as cerebral ischemia. Okay, that will lead to failure of vasomotor center. Okay, this center, it is responsible for releasing the sympathetic stimulation. It is responsible for sympathetic discharge. So sympathetic discharge will increase the BP. If the BP is increased, then the shock will eradicate. But that is, the center itself is getting suppressed. Why? Because there is low blood flow to that center. Okay, because of cerebral ischemia. Now this will lead to pooling of the blood in the veins. So what happens if the blood is pooled in the veins? There is decreased venous return, and it will lead to death. So this is the ultimate reason for the irreversible stage, why it cannot be compensated. Okay, because simply we can say that because of low blood to the heart and the low blood to the brain. These two are the final stages where a person cannot be revived. Okay, that is why this is said to be irreversible stage, and most commonly it will lead to death. Okay, I hope this is clear, and please do like, share, and subscribe. And thank you.